Hi, I am Miss Cornett. I am one of the health science teachers here at Liberty Creek High School. I have over 11 years experience as a nurse. In the last 7 years, I've worked as a nurse practitioner specializing in hospital medicine and infectious diseases.
Hi, my name is Dr. Meg Morley. I'm a nurse practitioner, family predominantly based, and have a history in military medicine, civilian medicine, caring for people 0 to 100. I, for the last 10 years, was working in primary care and have been excited to take a health science educator role here at Liberty Creek High. I currently teach health sciences and anatomy and physiology, and will be taking on medical therapeutics as well. I'm very excited to see you have interest in our program and see what your health career could hold.
The organization or club that we have that goes along with our health science program here at Liberty Creek is called HOSA. It's an acronym for Health Occupation Students of America, and it's also dubbed as Future Healthcare Professionals. It's 100% healthcare, so any student interested in a career in healthcare is encouraged to join this organization.
So currently we have almost 90 students in our CTSO, and so what that means is students either decide to be a competitor where they do different like healthcare competitions or tests or spelling, something that is strong suited for them that they get to choose. And the other option is to be a service hour member, so that's just getting community service hours to put on your resume.
This is just a really great opportunity for kids to get involved in the community and also to get more knowledge and skill that might not be available to them in the classroom. We love our HOSA members, and they have had a really great year getting the community and more students in our whole school involved in their efforts.
While we do love our HOSA students, you do not have to be a HOSA student to be in our health science CTE track. So you can choose to do one class, you can do 3, you can do all 4, depending on what track you end up taking. Our entry-level course is health science, which we offer to mostly freshmen, but you can take as a sophomore or junior or senior if it was an elective. Health science focuses on our career opportunities, kind of a basic entry-level look at infection control and what it means to work in healthcare and how we have healthcare delivery systems.
Medical therapeutics is our second level course. It's typically taken as sophomores. That course gives a deeper dive into specific healthcare careers, and it also dives further into the body systems and what is normal and abnormal, more pathophysiology and disease processes, and how to assess those on a patient.
And then our next level course is anatomy and physiology. This does have a little bit more rigor. It's a different type of science and learning. So we are looking at the normal functions and structures of the body, and then we introduce a little bit some pathophysiology, which is how the body is working incorrectly. This is usually offered to juniors, but it can be offered to select sophomores who wish to try to do a capstone level course as a junior or a senior.
Our capstone level course here at Liberty Creek is clinical internship is what we call it. We have 2 opportunities for certifications, so we will have 2 clinical internship courses moving forward. Those courses will be offered to juniors and seniors as long as they've met the requirements, meaning they've taken the level 1 health science, level 2 medical therapeutics, and level 3 anatomy and physiology course.
So our 2 certifications are a CCMA, so that's a medical assistant, so that's someone who has both a direct hands-on patient care job and a indirect, so that's like administrative, billing, coding, insurance, kind of thinking like the backside of the house, stuff that we don't always see when we go to the office for a visit. And our second one that we will begin offering is the patient care technician. So that is more of a therapeutic, hands-on patient, direct face-to-face care type of certification. And so that is for students who may be interested in being a nurse assistant, being a nurse, being a physical therapist, being a physician, someone who later in your life you're going to do something where you have a lot of face-to-face interaction with our patients.
So that clinical internship course is a year-long course, so it's taken over 2 semesters. The first part of the course is didactic, meaning we do our coursework in class. The second part of the course, or the second semester, is more clinical. So the student will actually go out into the clinical setting. Currently we have a partnership with TriStar Hendersonville Medical Center, and they allow our students to come rotate and do clinicals at their site. Once they complete the didactic and the clinical portion, there will be the opportunity to test for that certification, as Dr. Morley said. Moving forward, we have opened up a third track, which is a sports and human performance track. This is going to be geared towards those that are interested in careers such as physical therapy, sports medicine,
athletic training, orthopedics. So people who are more focused on a sports and rehabilitation injury perspective may benefit from going in that track.
There is a course that will be offered called Rehab Careers. That will be a prerequisite to entering that capstone course, which is exercise science. Currently, we are awaiting that position to be filled in order to fully offer that capstone course, but in the next year, we will be able to offer the Rehab Careers course as an option. Other certifications within the industry that we can offer are BLS, which stands for Basic Life Support. Most hospitals and clinics require this for all healthcare providers working in those facilities. Also, OSHA 10 is another certification that we allow students to get. That is a lifelong certification that they can carry on and be able to use directly in the clinical setting.
So we hope to see your interest in our program. We are excited to see the growth that we'll have in the next year, 5 years, 10 years, and to see the impacts that we can have on one summer.
Yes, the future of healthcare is here.